Hello to everyone. We are going to talk about the psychological management of dental fear and anxiety in this session. We're going to look at the different ways that once dental anxiety has been assessed, it can be formulated and the intervention can happen so that people can hopefully overcome their dental anxiety and they can get the dental treatment that they need. These are the ILOs for the session. Some of them are fairly big. Be familiar with the psychological, social, and cultural factors that underlie human behavior. That's fairly massive. And how these influence the patient's experience. We will cover these things as best as we can within the context of dental fear and anxiety. This will not be a conclusive overview of all of human psychology, sociology, and experiences. That's going to be a bit much for this afternoon. Be familiar with assessing. We spoke about assessing in the previous lectures. It's going to be a little bit covered in this. But if you're unfamiliar with the assessment tools, go back and look at some of the other links to the other presentations that are available on the module. And then we're also going to look at the etiology, the assessment and treatment of dental anxiety. Okay. So like I said, we're going to focus on the psychological approaches in this presentation to the management of dental anxiety. There is a way to bypass the psychological management altogether in some cases, which is sedation. That's obviously not possible or not appropriate in all settings. It is used sometimes with extreme cases where people are so dental anxious that sedation is used. There are debates that rage around whether that is or isn't okay, and the ethics around that as an intervention. It's controversial in some areas. So remember that is there, although should be used as a last resort rather than a first resort. When we're looking at dental anxiety, or indeed any type of mental health issue, the main model that we go to is the cognitive behavioral therapy 5 areas model. The 5 areas model is a good summary of all the different facets that are involved in any mental health presentation, any health presentation for that matter. In this presentation, you have the fundamental area of your biology, the physicality of yourself as an embodied being. This is obviously where pain, discomfort, tooth decay, toothache come into play. These are all aspects of biological functioning. And these are all biological entities that we're interested in when we're looking at dental anxiety. We've then got the two parts that you could say are to do with the person's subjective experience. So the two parts that would relate to their consciousness that we can't directly access out with self-report. And these are the person's thoughts and the person's mood or the person's emotions. The emotions are fairly simple and straightforward. Emotions are usually things that can be described in one word. Fear, sadness, anxiety. These are the words that are often the things that people use. Angry, other words that involve mood. When it comes to dental anxiety, the anxiety is obviously the main emotion that people feel. Often also, but anticipation of shame. So shame and guilt are other emotions that people will feel in this situation. Thoughts are the subjective experience that people have that's more narrative. So thoughts are the parts of the subjective experience that are maybe imagined simulations of the world, imagined realities. There may be thoughts about what you would like to do. I felt like running away from the dentist. That's not a feeling. The feeling is fear. The thought is I want to run away. These are the two parts of the subjective experience. You then have the behavior So behavior is what somebody actually does. Behavior is what I would see if I was looking at you as an objective observer. I would see your muscles moving. I would see the things that you're doing. In dental care, the behavior is getting the dental work done or not. That's obviously the big thing. It's not the only thing. It's also different ways in which people might avoid or deal with the pain. So they might cry, they might grab onto the chair tightly, they might try to ingratiate themselves to the dentist, they might get angry and display angry behaviors. These are all different behaviors, and the environment itself is the fifth element, and this is the element that's external to the individual themselves. The environment involves two things. It involves the physicality of nature. So the environment can be inherently threatening in a dental setting because the environment involves potentially a source of pain and a source of discomfort. But the other part of the environment is the social environment, the reality of other people. And the negative side of the environment when it comes to other people is judgment and or exclusion by other people. So the guilt and the shame that people feel when they come to the dentist are often to do with the experiences that they may have with dental staff who tell them that they're not meeting up to standards, or they're not good enough, or they're somehow bad. So that is the potentially threatening aspect of the environment. So this is the CBT 5-factor model, and this is how we would describe it and think about it when we're interested in dental anxiety. So we're going to talk about the treatment strategies and the things that can be done at different levels of anxiety to help patients to reduce their levels of dental fear. From mild to moderate dental anxiety, the treatment strategies are fairly straightforward. The foundation of any treatment strategy for dental anxiety is the attitudes and the communication of the dentist and the dental staff. Now, we've talked about communication previously and the importance of having a trusting relationship with the client. And we've talked about how a lot of that is based in personality and in the underlying factors that influence your own being as an individual. However, there are practical things that you can do as well along those lines. The acknowledgement of the patient's feelings is really important. It's okay to be anxious about pain. It's not it's not something to be shameful of. Although dentists, for them every day they go through this process, for the patient it's a novel experience, and also the dentist isn't the one experiencing the pain. It's the patient. Therefore, setting up a situation where the patient feels as if it's okay and they don't have to pretend or hide that anxiety, or the dentist doesn't understand it, that's usually important. The level of control that somebody has or somebody feels that they have is directly proportionate inversely to the level of stress and anxiety that they feel. The more control somebody feels, the less anxious they feel. What this means is that there's a whole series of things that dentists can do to provide control. Realistic information and predictability are hugely important. Making clear what the goals are of a treatment, making clear what the process and the procedure will be, making clear how long it will take, and making clear all the other aspects of the procedure as you go along. That's hugely important. Telling the patient before you put the chair back, telling the patient before you go to examine their teeth. Simple phrases like, I'm just going to put the chair back now. That's really important, rather than just surprising the patient and putting it back before they realize what's going on. There are also strategies that can be used. Distraction is about moving the patient's concentration to something else, to something that is not immediately threatening to them. When you are stressed, when you're anxious, your attention is focused upon the thing that you're afraid of. And it's very hard to shift that attention away to something else. But if the level of threat is small, this works for patients with mild or moderate anxiety. If the level of threat is small, relatively small, then the patient will still have enough cognitive control to be able to shift their attention away to something else. Now, saying to a patient, think about something else isn't helpful. It's too general, it's too vague, it's not particularly practical. But providing situations where a patient can think about something else can be hugely helpful. I'm not sure why dentists don't have TV screens installed in the ceiling of their dental practices. I think that would be hugely helpful. We know that TV is very good at distracting people from the situations that they're currently in. So having this available to patients when they're in the dental chair would seem the obvious thing to me, although I don't really see it in practice anywhere. Relaxation can also help. Now, what happens when you're stressed is that the fight or flight system kicks in. Your heart rate goes up, the blood pumps to the big muscle groups in your body, you have increased adrenaline and cortisol flowing through your body, your pupils dilate, your muscles tense up, etc. This is a really good system for dealing with physical threat, which is what it evolved for. It's not very good for trying to get through a dental procedure if you're anxious. So what would be great would be if you could have conscious access to your heart rate to turn your heart rate down. That way you could control your fight or flight response directly, and you could turn it down to appropriately match the situation that you're in. You can't do this. You've got no conscious control over your heart rate, but what you do have conscious control over is your breathing. Your breathing can be used to bring down your heart rate and to bring down your levels of stress. So there are various techniques come under the general label of controlled breathing. This is called box breathing. I'm going to show you a quick clip here of how box breathing works.
There are times when we all experience feelings of stress or anxiety. In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier.
Okay, that's a fairly useful resource. There's lots of other techniques as well, and they're fairly simple to teach to clients as well, especially with the likes of YouTube. There is pharmacological support as well. Benzodiazepines prior to particular types of treatments. Obviously, a fairly extreme form of intervention. There's a lot of problems with addiction when it comes to benzos. It's a relatively problematic treatment, so it's not to be taken lightly and it's not to be considered anything like a first resort. What we find when we look at the literature is that whenever you do these types of interventions, patients are much more likely to have reduced fear and also avoidance as well. So that means that they're less likely to avoid the dentist, they're more likely to get their treatment done, which means that their teeth will be healthier, which will, in the long run, reduce the strain of the amount of cases on dental practices. So it's something that we should be practicing fairly routinely within dental care. Distraction, who uses it to facilitate coping? A lot of people will use it as a way to cope. You might yourself use it in your day-to-day life. You may well find, if you're stressed about something, looking at your phone to play a game to distract yourself, for example. You might find yourself daydreaming, thinking about some plans that you've got for the future. The different techniques that you use are ones that patients can also use. Think about the ones that you use and think about how you can use them, and you explicitly tell patients to try them. So instead of saying, just try to think about something else, get the patient to answer questions in their own head. You can say to them, what holiday plans have you got? Or what holiday plans would you like to make? Get them to think about those plans, get them to plan it in their head. Like I said, more control equals less stress. This is a very important relationship to remember when it comes to dental anxiety. And it's something that you should have in your mind all the time as a dentist practitioner. There are other specific ways to give patients control over what is happening when they're at the dentist. Simple things like stop signals. Giving the patient something, place your left hand in the air if you want me to stop, something like that. It's a really good way to give them control. They know that if it comes to it, the procedure can stop and it's in their control. Rest signals as well allow the patient to stop with the understanding that the treatment is not finished yet. So it doesn't necessarily mean that the treatment is over. It means that the patient just needs a break. These are really simple ways to give patients more control. Proceed signals are also important. Asking the patient, open your mouth when you're ready to start, as opposed to just asking the patient, open your mouth. It seems relatively simple, but there's actually quite a big difference. The difference is that the patient is volunteering to have the procedure starting rather than having you make the choice. What do you want to happen? Again, this doesn't necessarily mean that the patient is making the dental decisions, but things like which tooth will we start with, decisions like that give the patient control. It means that the patient can say if they have a preference, whether it's a tooth near the front or it's one that maybe is on the side that they feel most discomfort from. These kind of things can make a big difference to patients. So when you've got slightly more severe dental anxiety, the best treatment that works the best by far is exposure-based treatment programs, which is sometimes called systematic desensitization. This is when you gradually expose the patient to the thing that they're afraid of. The patient can be first trained in relaxation, although you don't actually need to do this. What you then do is you decide or the patient decides what is the most scary thing that they are afraid of when it comes to the dentist. Quite often I get patients to rate these from a scale of 0 to 10, 10 being the most scary, 0 being something that they're not at all bothered about. Sometimes it may be that even something as simple as sitting in the dental waiting room is actually quite scary for patients. It may be that if you ask a patient, they're experiencing 4 out of 10, 5 out of 10, maybe even up to 6 or 7 out of 10, just by waiting in the waiting room. Now, what the literature shows is that if you do this, and then if the patients decide where they're going to start, and they decide that they are going to expose themselves to the feared stimulus, they're going to go and practice doing the thing that they're afraid of. What you find is that about 12 to 16 times of doing the thing extinguishes the fear. You don't start with a 10 out of 10 or a 9 out of 10. It's very difficult to jump straight in with that. Patients will just avoid. They won't actually do the exposure. They'll either mentally avoid, they'll find some way to not expose themselves to the actual threat, or they will just physically not turn up. This obviously doesn't work and isn't hugely helpful. What you do is you choose them, you help them to choose things that they're a 3 to 4 afraid of to begin with. So say it is sitting in the dental waiting room. So coming into the dental waiting room and not even necessarily having a procedure, but just coming in and sitting there. Doing that 12 to 15 times will eventually distinguish that fear. What happens is the limbic system of the brain, the part where emotions are controlled, learns from the exposure that there's nothing to be afraid of in that particular circumstance. So it learns that the feared outcome of being in the dental waiting room doesn't happen. That feared outcome being an imagined example of catastrophic pain or something like that. So a hierarchy can be drawn out in terms of 1 to 10. It can be drawn out as a ladder like this as well. Things to make me most anxious down to the things that make me the least anxious. And this is just an example of what might be on that ladder. We've obviously spoke about sitting in the waiting room, seeing the needle and holding the needle. One of the things that's quite useful to try with patients when it comes to exposure to needles is for the rehearsal to happen of the situation where the dentist or the healthcare professional comes towards the person with the needle, and they say to the dentist, "Stop," and then the dentist stops, and the patient can walk out the room. Now that might sound quite silly, because you might think the patient knows that, if I've spoken to them and I've said to them, I can stop at any time, you can say, oh, they know that they can stop. But people know things at different levels. People can know things in their prefrontal cortex where their abstract thoughts are, but it's not embodied, it's not practiced. And once they've practiced it, they learn it at a deeper level. This is obviously the case when it comes to learning, other skills. Things, say, like sport. You don't learn sport in the abstract, in the thinking realm. You learn it in the practical realm. You learn it in embodied practice. It's the exact same with dental fear. You have to learn it through embodied practice rather than through something that's abstract. There's 2 biological systems when it comes to movement, essentially. There is your fight or flight response, which is when you are seeing yourself as the prey animal, you're seeing yourself as the rabbit. You're experiencing the process as being something that's forced upon you, something that you have to do. But human beings aren't only prey animals, they're also predators. They're also animals that pursue things. Now, pursuit of a problem, pursuit of something that is sought after, is voluntary. Voluntary pursuit is what makes the change. Voluntary pursuit is when somebody has decided that they are going to engage in the behavior. Now, this can look almost the same to a casual observer. You can have two patients who are both in the dental chair, and one in a state of fear, in a state of fight or flight. And they secrete cortisol, they're very stressed, and their pain will be heightened. Whereas you can have a patient in the same situation where the dentist has worked with the patient, so the patient has voluntarily chosen to engage in either the dental procedure or in the exposure. And because of that voluntary choice that they've made, they are in a very different physiological state. They are deciding to tackle the problem. They are deciding to deal with their dental anxiety. They are deciding to get the treatment. And as they do that, they're much more likely to be more focused, much more calm, much more relaxed, and much more likely to have the procedure. The most straightforward desensitization program involves the different steps that we've spoke about so far. Relaxation training, giving control to the patient as much as possible, and then doing graded exposure using a fear hierarchy in order to get the patient used to each of the fear stimulus. Another strategy that works well is the use of real life dental situations, quite often in videos, in order to help the patient to face the thing that they're afraid of. This gives the patient control. This gives a patient more detailed information about what it is that they're going to face. The more information that people have, the more they feel in control. The more control they have, the less stress they feel. This is an example of a type of video that can be useful to look at what happens during a dental checkup.
Hi, we're here today because oftentimes we get the request and people will say, what goes into a dental checkup? So Brittany has agreed to be our patient today, and we'll just talk about what goes into a typical dental checkup. So first thing we do is we talk to our patients. How are you, Brittany?
Good, how are you?
Very well, thank you. Good to see you again.
Good to
And
see
you
you.
were a new patient here 6 months ago.
Correct.
And at that time, we took a full set of x-rays. It had been a while since you had any dental x-rays, and we did a pocket depth measurement to evaluate your gums. And at the time, we determined that your gums were great. That's wonderful. And that you had a few cavities, and we fixed those with some nice white composite fillings. How's everything feeling in your mouth now?
It's pretty good. It's doing all good.
Glad to hear it. Okay. So it's been 6 months. And the first thing I want to know is, first of all, how are you? How's your general health?
It's been the same.
Okay, and you weren't taking any medications at that time. Are you taking any now?
No,
Okay, so no changes in health history, no medications. Do you have any dental concerns, any aches or pains or anything that may have gone wrong since I've seen you last?
no.
No, okay, good, that's great, all right. And since we took x-rays last checkup, if you don't have any concerns, unless I see something, we probably won't take any x-rays today. All right, so we're scheduled for you to see the hygienist today, and she'll clean your teeth. But first, I'd like to do an evaluation of hard and soft tissue. Hard tissue meaning teeth, soft tissue meaning gums. So I'm going to lean you back, shine a light in here, and we'll just take a look, okay?
Sounds good.
All right, very good. Okay. Brittany, I remember you last time as being a wonderful patient. Thank you very much. Wish all my patients were as wonderful as you. All right, we're going to shine a bright light. And the first thing we just do is just get a general look. And I'm just going to retract back your lips and take a peek. Dentists love to use light, either on a scope on our head with magnification or from an overhead light. And we love to use air to dry teeth. And that really gives us a good view here. So we're not taking any x-rays today. And your teeth look terrific. Clinically and visually, everything is fine. Soft tissue looks good. No inflammation. Are you flossing these days?
Yes,
That's
twice
true.
a day.
Twice, wow, twice a day. That's fantastic. I'm sure you're not just saying that for the camera. And I'm just going to take a look. Oral cancer screen. Stick your tongue out at me. Very good. Excellent. Let's say, okay, everything looks great. everything looks great, we're gonna have you see the hygienist for a cleaning, and then you'll be set for another 6 months.
Okay, awesome.
Thank you
Thank
very
you.
much, and thank you very much.
A relatively straightforward video that shows you what happens during a dental checkup. One of the things that I wouldn't have done if I was putting that video together is near the end, he mentioned cancer screening. I don't think I would put that in. I think a patient who is anxious might well pick up on that and be slightly scared by that. There are specialists who work with more complicated dental fear. Sometimes there are other comorbid issues that need to be addressed at the same time. Clinical psychologists and health psychologists or CBT therapists who specialize in this area will be the people who would be most helpful when it comes to referrals. The cognitive behavioral therapy approach is the one that's most useful in terms of understanding anxiety and the role that it plays within dental situations. Exposure therapy is the behavioral side of therapy. It's behavioral because it involves the actual muscles, things that we can see. The cognitive side involves looking at the thoughts that drive patients' behaviors and looking at what are the different ways in which their thinking cause them to avoid the dentist and similar experiences. Identifying negative thoughts and identifying negative thinking patterns and challenging them and modifying them is a good way to bring about the possibility of behavioral change for clients. Cognitive change, challenging people's thoughts, challenging people's ideas is useful, but it's not enough. It must be done with the group, with the exposure therapy at the same time. Exposure therapy is what makes the biggest difference when it comes to people's actual emotional experiences. Quite often in CBT, when we're looking at cognitive treatment strategies, we'll use things called dysfunctional thought records. What these do is to get patients to, in real time, in real life situations, write down what their thoughts are in a situation where they are upset about something. What happens with thoughts is that sometimes it's hard to recall what you were thinking in a situation whenever you try to reflect upon it, maybe hours or days or maybe even weeks later. Thoughts are quite strange phenomena. You don't really decide to think a thought. It's kind of there in your head very often. And so as a result of that, they're often quite dreamlike. And therefore, the best time to capture them, what's actually going through your head, is as close as you possibly can to the time. Sometimes thoughts are words and phrases. Sometimes they're memories. Sometimes they're images. In CBT, we often call these automatic thoughts or negative automatic thoughts. So in the situation, say the client is coming into the dentist and they are walking into the surgery itself, automatically they can have a negative thought that's maybe an image of them being in the dental chair and being in a lot of pain. It's also useful to look at the emotion that's attached to that. The emotion that's attached to it is quite often negative. It's usually anxiety. It can be sometimes they word it as being stress or fear. It's all the same basic emotion. And then what we can then look at is, in what way is that thought not related to reality? So particularly when it comes to dental pain, the thought distortions will be around the level of pain, the level of discomfort, and or maybe the level of shame and embarrassment that the patient will feel when they react to the pain or discomfort. the images that are pictured in our heads are often quite exaggerated. They're often not representative of reality. And if we look at that, we can see that there's a distortion. We can see that there's a contrast between the way that we're thinking and what the reality is. And the alternative thought is, what is the actual reality? What does the reality look like? So for the situation where the patient is coming into the dental surgery, the thought is an image of them being in excruciating pain, maybe screaming, maybe crying, maybe embarrassing themselves. What's the reality? What's the alternative thought? Well, the alternative thought is maybe them feeling discomfort, maybe pain even, maybe 2 out of 10 or 3 out of 10 pain, but possibly not shouting or screaming or fainting or all the other things that they think is going to happen. When we're looking at thoughts and how thoughts might be changed to alternative thoughts and alternative patterns of thinking, it's important that we get rid of the idea of challenging thoughts. Challenging is when you end up in an argument with someone. Whenever they say a statement about the world, you try to give a statement that portrays the world in the opposite light, and then they give you a reason why you are wrong, why you're incorrect. Sometimes challenging goes okay. Somebody says, I've never coped well with pain and I'm rubbish at everything. Challenging whataboutism is one of the big ways of challenging thoughts. You might get, if you say what about when your child was born, you might get an answer of, I got through it pretty well. I only asked for gas and air if I needed it. Or if you challenge a thought, you might get a response like, yeah, that's a good example. That was totally terrible. I hated it. So challenging can, in some ways, just confirm what somebody already thinks. You might also get a response where they say that doesn't count because childbirth is natural, whereas getting a tooth extracted isn't. They could have lots of reasons why they're right in this situation and you're wrong. So we want to get rid of the idea of whataboutism. Okay, whataboutism is not good. Okay, we want to basically kick it out the door if possible.
Piss off, ghost! It's freaking gone.
I think we should say that to whataboutism. So whatabout does not work. So we're exploring thoughts. We want to give the thought as much credence as it deserves. We want to look in as much detail to it as possible. So exploring the evidence that supports the thought to begin with. I've never been able to cope well with pain and I'm rubbish at everything. You might then want to explore it and say, well, okay, have you had any experiences of a lot of pain before? This same patient, yes, when I gave birth to my first child. Exploring, yeah, I've heard how painful that can be. What was it like once your child was born? That's exploring the issue. It's looking at a real life experience of real pain, which is very difficult for a lot of people. And a lot of people do find it extremely painful. But at the end, the pain is gone. The pain isn't remembered, certainly not to the extent that it was experienced. And there's something came as a result of it. So pain in itself and experiencing pain isn't the end of the story. There's something else after the story. Also, looking past the feared outcome is very important. Often we haven't looked past the thing. So people are afraid to come to the dentist because they're afraid that their tooth will hurt. And again, that may be true. Or they've got the fear that there'll be discomfort. That may also be true. That's maybe more likely to be true. So we can admit that. And we can then ask, okay, your tooth might be sore. That may be correct. Then what happens? What happens next? What does your life look like an hour after getting your filling fixed? What does your life look like a week after? What does your life look like 2 weeks after? the painful experience for most people when they're imagining it in the future, the painful experience is the end of the story. But of course, we know it's not the end of the story. The pain will go away, and then you'll be left with a tooth that's fixed, that's better than what you've got just now. So if any challenging is going to be done in a session, it's important that it's the patient and not the clinician that's challenging the patient's thoughts. When anxious patients come up with facts that do not confirm their beliefs, there is a subsequent decline in their perception of risks. So it has to be something that they generate themselves. It can't be something that you come up with. You can question and explore, but the challenging has to come from themselves. That's the only thing that works in terms of making a difference to their thoughts. Now, there are obviously situations where dental anxiety is part of a deeper psychological issue. There's maybe other aspects of a person's mental suffering that move beyond the scope of normal dental care and need to be referred to a psychologist, a psychiatrist, or sometimes a specialist dental clinic who specialize in dealing with anxiety. Sometimes as the patient's in a lot of pain and the psychological issues are such that treatment would be too overwhelming, or the patient isn't willing to have treatment, then some kind of medical intervention, pharmacological intervention, general anesthetic, for example, may be appropriate. Deals with the current medical crisis or the current dental crisis in terms of pain, and then dealing with the underlying psychological issues in a more structured way after the immediate crisis has subsided. So in conclusion, when we're looking at fearful behavior within the dental clinic, we need to think about the thoughts, the feelings, the behavior, and the situation, and how those things impact upon the avoidance of the dental treatment that needs to be carried out. There will be underlying, potentially long-term, long-standing issues that need to be looked at. Behavioral exposure and behavioral management is very important, but it's not just about making sure that the treatment is done quickly and the patient's out the door. It's about managing the underlying fear and anxiety, and hopefully even extinguishing it so that the patient is able to get dental treatment in a more functional manner in the future. You can look at people's underlying cognitions, underlying thoughts, and their beliefs, and you can look at restructuring these, but it has to be done through very careful work with the client, where any challenging of thoughts comes from the client, and it has to be tied into behavioral work. The behavioral work is vastly important. Getting information to dispel common fears and myths is a very useful step to hopefully bring about change in the client's beliefs so that they are more likely to engage in positive behaviors with the dental treatment itself. Simple desensitization can be carried out in clinic. If this is not useful or not done properly, or there's nobody able to do it properly, then more help available. Sedation can work, but it's not the go-to solution if we can possibly not use it. Local psychological services will be able to provide you with more help on dealing with clients who have particular issues along these lines. There is plenty further reading. These are your references.